Preventing Heart Disease, presented by Mendy Musa, Manila Rana, and Ruby Small. Good evening, everyone. My name is Mendy, and I'm here with my colleagues Manila and Ruby. We've been invited today to introduce and inform you about heart disease. Today, me and my colleagues will be covering what heart disease is and any prevention information. So, what is heart disease? Cardiovascular disease will commonly be known as heart disease. It is unfortunately the leading cause of death in Australia. Cardio means the heart, while vascular relates to the blood vessels. According to the World Health Organization, cardiovascular disease is an umbrella term that describes a range of conditions that affect the heart. Today, we'll be focusing on three most common types within your age group. The first one is coronary artery disease. More commonly known as CAD, is Australia's most common type of heart disease, as the blood supply to our heart becomes disrupted as blockages occur in our arteries due to the buildup of plaque and cholesterol in the inner walls. This reduces blood flow back to our heart, causing chest pains, fatigue, and shortness of breath. A heart attack occurs once there's a full blockage. Second is irregular heartbeats, arrhythmias, which refers to when a heartbeat is irregular, which could either be way too fast, way too slow, or could just be irregular and skip a few beats. Issues in the heart's electrical system causes arrhythmias, as it controls the rhythm and rate of our heartbeat. It can either be life-threatening or unserious, as symptoms can vary from a minor flood in the chest to a detrimental sudden blackout. Disease of the heart muscle, cardiomyopathy. Cardiomyopathy is the disease of the heart muscle and makes it harder for the heart to pump blood to the rest of our body. There are multiple types, including dilated, hypertrophic, and restrictive cardiomyopathy. The condition is mostly genetic, however, it can be caused by other factors like the damage to the heart tissue from a previous heart failure, hypertension, or even infections can cause it. Why is heart disease relevant to you? Well, after viewing your survey results, we've noticed a lot of you guys have high blood pressure, a high consumption of alcohol, high tobacco use, and reduced physical activity. Unfortunately, this puts you all at very high risk of heart disease. Here's some facts according to the Health Research Institute. CVD kills 1 in every 4 Australians. In 2021, it was the underlying cause of death, causing 42,700 deaths, which is 25% of all deaths. Every 12 minutes, 1 Australian dies from CVD. That's 118 deaths every day. Around 1 in 5 will die within 28 days of a stroke. 1 in 3 people will die, and 1 in 3 people will die within a year. Stroke is a leading cause of disability in Australia, and more than 80% of strokes can be prevented. And we hope you leave here today being more educated in the decisions you make regarding your health and who you can go to for help. So, what causes heart disease? There are many factors to look at when we're identifying these causes. They can fall into 2 categories. Modifiable risk factors, these are factors we can control and we can change, or they can fall into non-modifiable risk factors. These are factors we have no control over. Under modifiable, we have smoking. If you smoke, the best thing for you right now to do is quit. The survey has shown a lot of you guys are smokers. There are substances and chemicals in tobacco smoke that damage your arteries. Heart attacks are also much more common in smokers than in non-smokers. Next, we have stress. Unrelieved stress may damage the arteries and worsen other risk factors for heart disease. Uncontrolled high blood pressure can cause the arteries to become hard and thick. This interrupts blood flow to your body. Diabetes also imposes a risk. Under non-modifiable risk factors, we have age and gender, as growing older increases your risk of damaged and narrow arteries and can cause weakened or thickened heart muscle. Men are at a significantly greater risk than women when being diagnosed with heart disease. The risk of women increases after menopause. A family history of heart disease can also increase the risk of coronary artery disease. So, what to look out for in coronary artery disease? The most common sign and symptoms can be chest pain, which is described as tightness or pressure and pain in the chest. You also may develop a shortness of breath when your heart isn't able to pump blood for your bodies, or you develop extreme fatigue with physical activity. Heart attack. Heart attacks occur when an artery is blocked. Signs of a heart attack can include increased episodes of chest pain, sweating, vomiting, and nausea. As shown in the figure here, we have other symptoms like fatigue and dizziness. If you take a closer look, we also have visuals of what a clogged artery might look like when it's clogged with plaque and cholesterol. Signs and symptoms to look out for if you think you may have arrhythmia. Palpitations. This could mean having a pounding, fluttering, or a really fast beating heartbeat. Palpitations can be felt in the throat, neck, and chest. These beats are not serious, but can be extremely uncomfortable and a sign of a serious condition. Irregular heartbeat. Any heart rate above 100 beats per minute is known as tachycardia. Anything less than 60 beats per minute is known as bradycardia. We need to make sure we're keeping in mind that your heart rate can be 40 to 60 when resting or asleep. Discomfort in the upper abdomen. A rapid heartbeat can also disrupt the heart's efficiency and reduce blood flow, leading to chest pain. What to look out for in cardiomyopathy, which is also known as the disease of the heart muscle. Swelling of the ankles, feet, and legs. As the heart's ability to pump blood is reduced, blood can't make its way back through veins. This causes fluid to collect in the bodily tissues, usually in lower parts due to gravity. The skin may have a grey-blue tint due to the restricted blood flow. Fatigue, or you could have heart murmurs. These are described as swishing or whooshing noises made by the turbulent blood near our heart or in our heart. Most times these aren't serious, although can give us early indicators of heart valve issues. A reduced ability to exercise. You may notice you are out of breath and become extremely exhausted during the activities you performed previously with no issues. Coughing and wheezing. Pulmonary edema is caused as fluid builds up in our lungs. The increased pressure in our heart and lungs causes leakage to the lung tissue, which overall affects your ability to breathe, causing wheezing and coughing. Breathlessness at movement and rest, and the persistent urge to urinate could all be signs of cardiomyopathy. All these signs of different heart diseases could indicate a serious condition, and you need to be sure to contact a health specialist if you think you have any type of cardiovascular disease.
For the banking professional, the potential outcomes of cardiovascular disease (CVD) can have significant implications across various aspects of their lives. Let's explore these outcomes and explore the ones would be most relevant to your audience. The first one is health outcomes. The primary concern for banking professionals would likely be the direct health impacts of CVD. This can include heart attack, stroke, heart failure, and related complications. Given the demanding nature of their work and potential stress level, the risk of cardiovascular event is critical health concern for the audience. 2 is psychological impact. Stress and anxiety related to CVD risks and diagnosis can have a profound effect on mental well-being. Fear of future health complications, managing chronic condition, and coping with lifestyle changes can contribute to the physical, psychological distress. This aspect is particularly relevant as mental health awareness and support are increasingly prioritized in workplace. Third is social implication. CBD can impact social interaction and relationship, especially if individuals face limitation in physical activities, require caregiver support, or experience changes in their lifestyle due to health concerns. Maintaining social connections and support network becomes crucial, particularly in high-stress environments like banking where managing and networking are integral to success. Considering the audience of banking professionals, the most relevant outcomes would likely be the health impacts and economic consequences of CBD. These individuals are likely to be highly motivated by the potential effects on their health and financial well-being. The first one is absenteeism and reduced productivity. CBD-related health issues can lead to absenteeism, decreased work performance, and productivity losses for both employee and employers. Work stress. Balancing work responsibility with managing chronic conditions like CBD can contribute to stress, job dissatisfaction, and employee turnover. Another one is impact on career progression. Severe CBD events on ongoing health challenges may limit career advancement opportunities and professional development. Healthcare costs. Managing CBD requires regular medical visits, diagnosis tests, medication, and potential intervention like surgeries or cardiac rehabilitation, leading to substantial healthcare expenses. Another one is insurance premium. Individuals with CBD may face higher health insurance premiums, deductibles, and out-of-pocket costs, impacting their financial planning and budgeting. Income loss, absence from work, disability, or early retirement due to CBD can result in income loss, reduced retirement, saving, and financial insecurity. The last one is employer costs. Employers bear the cost of absenteeism, reduced productivity, disability, accommodation, and healthcare benefits per employee with CBD, affecting business profitability. This illness be prevented or progression slowed. First one, we have healthy lifestyle choices. Encourage regular physical activity. Recommend at least 150 minutes of moderate intensity aerobic exercise per week. Promote a balanced diet such as fruit, vegetable, whole grain, lean protein, and healthy fat while reducing intake of processed food, sugar, salt, and saturated fats. Advocate for weight management. 2. We have tobacco cessation. Offer smoking cessation programs, provide resource, counseling, and support for employees who smoke to help them quit tobacco use. Create tobacco-free policies. Implement workplace policies that discourage smoking and promote a smoking-free environment. 3. We have alcohol moderation. Provide education on safe alcohol consumption. Encourage moderation and awareness of alcohol impact on cardiovascular health. Next one, we have stress management. Promote stress reducing techniques. Encourage mindfulness, relaxation, exercise, yoga, or medication to help employee manage work-related stress. Provide access to mental health resources. Offer counseling services, employee assistance programs, and workshops on the stress management and reliance. 5. We have regular health screening. Conduct cardiovascular risk assessment. Encourage employees to undergo regular health screening for blood pressure, cholesterol levels, blood glucose, and BMI to identify and manage risk factors early. Facilitate access to preventive care, support employees in scheduling routine check-up, immunization, and screening as part of their overall healthcare plan. 7. We have health, education, and awareness. Provide educational resources, offer workshops, seminar, webinar, and digital resources on cardiovascular health, risk factor prevention strategy, and healthy lifestyle habits. Last one, we have workplace wellness programs. Implement wellness initiative, develop comprehensive workplace program that includes fitness challenges, nutrition, education, mental health support, and incentives for healthy behaviors. Foster a supportive environment. Create a culture that value and prioritize employee health and well-being. Promote a work-life balance that support cardiovascular health. By incorporating this prevention measure and promoting a holistic approach to cardiovascular health, banking and all the professionals can reduce their risk of developing CBD and improve their overall health being. Regular monitoring, lifestyle modification, and a supportive workplace environment play crucial roles in preventing CBD and supporting cardiovascular
wellness. How is heart disease treated? For heart disease to be treated successfully, a combination approach of treatments is used. These incorporate lifestyle modifications, medication, interventional procedures, and surgical procedures. Treatment for heart disease often begins with lifestyle modifications. This method's main aim is to help reduce or delay the need for more invasive treatments such as surgery. Individuals are advised to adopt heart-healthy habits, including reducing smoking, changes in diet, weight management, and regularly exercising. These measures help to control risk factors and enhance overall cardiovascular health, as well as aid in improving the effectiveness of other treatments that may still be needed. Medication plays a crucial role in managing heart disease during treatment. Individuals may be prescribed medications to lower blood pressure, reduce cholesterol levels, prevent blood clots, and manage other underlying conditions such as diabetes. These medications aim to alleviate symptoms, prevent complications, and slow the progression of the disease. However, medications cannot fully treat heart disease alone and are more effective when paired with lifestyle modifications. In cases where lifestyle modifications and medications alone are insufficient, medical procedures are highly recommended. There is a wide range of high-standard cardiac care with access to skilled healthcare professionals that can advise on the most effective medical procedure for the individual. Interventional procedures are the most common medical procedures used in treatment and include less invasive surgeries such as angioplasty and stent placement, which are used to open narrowed or blocked arteries, restoring blood flow to the heart. Surgical procedure options, including coronary artery bypass grafting and heart valve repair or replacement, may be recommended for more complex cases where interventional procedures are not successful. The healthcare system emphasises this form of approach to heart disease treatment, combining medical expertise and advice beside patient empowerment to address the needs of individuals affected by heart disease. By prioritising prevention, promoting healthy lifestyles, and delivering high-quality care, the burden of heart disease is overall reduced on the population. Local resources. A range of local resources ranging from specialised healthcare facilities to support groups and public health initiatives are available for those living with heart disease. The Heart Foundation of Australia is an organisation that helps to support heart health across the nation. They offer a range of resources, including online information, helplines, and community events aimed at raising awareness and providing support to individuals affected by heart disease. Through their website and local branches, people can access information on prevention, management, and daily living with heart conditions. In addition, various public health initiatives run by the Australian government, such as the Cardiovascular Health Mission, are directed at preventing and managing heart disease. They achieve this by promoting awareness campaigns, community programs that teach about healthy lifestyle choices, and use specific initiatives that target high-risk groups such as Indigenous communities. With the New South Wales Cardiovascular Health website, which can easily be accessed on any device. The website serves as a central hub for accessing information regarding heart disease prevention, as well as risk factors. And for those seeking more personalised support and guidance, the website has a list of local hospitals and medical centres across the New South Wales region that offer specialised cardiac care services. These facilities provide diagnostic assessments, treatment options, and rehabilitation programs tailored to specific needs of the individual and their heart disease. Examples include the Royal Prince Alfred Hospital in Sydney and John Hunter Hospital in Newcastle, which are both renowned for their expertise in cardiac care and research. Furthermore, heart disease doesn't just impact one's health, it can put a strain on a person's well-being. Support groups address this issue and are crucial in fostering emotional support and sharing practical advice among those living with heart disease. The Heart Support Australia, for instance, organises regular meetings and events where members can connect with peers, share experiences, and access educational resources. By making use of these resources, those burdened with heart disease can proactively manage their condition, retrieve the relevant information needed, and find the necessary support to lead fulfilling lives despite the challenges posed by heart disease.